मंत्रिमंडल में हम सब साथ करने वाले और साथ काम करने वाले हमारे सहयोगी भाई श्री धर्मेंद्र प्रधान जी, जो भारत सरकार में पेट्रोलियम एंड नेचुरल गैस मंत्री हैं, आज के कार्यक्रम में उपस्थित हमारे उड़ीसा के स्वास्थ्य मंत्री श्री अतनु सब्यसाची नायक जी, सेक्रेटरी गवर्नमेंट ऑफ इंडिया मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर श्री भानु प्रताप शर्मा जी, श्री सी के मिश्रा जी एडिशनल सेक्रेटरी और एनएचएम के मिशन डायरेक्टर, श्री आरती आहूजा प्रिंसिपल सेक्रेटरी मिनिस्ट्री ऑफ हेल्थ फैमिली वेलफेयर गवर्नमेंट ऑफ उड़ीसा, श्री राकेश कुमार जी हमारे जॉइंट सेक्रेटरी गवर्नमेंट ऑफ इंडिया मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर, देवी और सज्जनों, यहाँ उपस्थित हमारे डेवलपमेंट पार्टनर्स WHO, यूनिसेफ, इट्सू, पब्लिक हेल्थ फाउंडेशन और बाकी सभी संगठन, हेल्थ क्षेत्र में काम करने वाले हमारे सभी लीडर्स, मीडिया के सज्जन वृंद, प्रिंट मीडिया और इलेक्ट्रॉनिक मीडिया के हमारे साथीगण और उपस्थित बंधुओं, मेरे लिए ये बहुत ही ऐतिहासिक मोमेंट है. This happens to be a very historical moment for me to witness this launching of rotavirus vaccine. This is not a routine program. It is a historical occasion. It is a program which sets a goal in the field of public health, and India goes forward as far as public health program is concerned. By launching this rotavirus, taking a pledge that giving this rotavirus in coming times to 27 million children throughout the length and the breadth of the country is certainly going to give effect in reducing IMR and also see to it that the public health is taken care of. We all know that approximately yearly 80,000 children die because of rotavirus, and approximately 10 lakh children are hospitalized yearly suffering from rotavirus disease. And it's very fatal. The time span to take care is very less. So it's a very cost-effective intervention which has taken place. It's very effective, it's cost-effective, and it's also going to give us bring a change in the health scenario of the children and see to it that we are able to address the issue of IMR. We all know that we have done good, fairly good as far as the MDGs are concerned. We have been very close to MDGs. National Health Mission has played a very important role in bringing these interventions. States have cooperated us. When we talk about IMR, MMR, TFR, you will be happy. I would like to share with you that the rate of prevalence and the rate of reduction is faster than the international rate. So that is one good thing that we can say, that in coming times we'll be able to address this issue in the right perspective. If we talk about MMR, in 1990 it was 560, which is now reduced to 167 in 2011 and 13. And if we talk about 15, 16, it will be much better. If we talk about under 5 mortality, it was 126 in 1990, which is now 49 in 2013 and much better in 2016. If we talk about IMR, It was 80 in 1990, which has now reduced to 40 in 2013. If we talk about TFR, in 1990 it was 3.2, and now it is 2.3 in 2013. Not only that, there are 26 states which have reached the replacement level of 2.1. Few states are there which need to be addressed, and if we are able to successfully address those states, certainly our replacement level will come very soon to the right level. If we talk about the prevalence of HIV/AIDS, we have reduced the prevalence also, and we have reduced the mortality also. We have seen to give them a qualitative life by introducing the third line treatment, and by taking into account that we will take under the ambit of treatment of HIV/AIDS patients who are suffering from the CD count 4 of 350. Now we are taking care of CD4 count of 500. So nearly 1 lakh patients, HIV patients, are taken into the field of treatment. So their quality of life is also going to improve upon. That is what I would like to say. We have been successful because, in spite of many limitations, we have been successful in polio eradication. We have been successful much before the goals set by MDGs in neonatal tetanus, elimination of neonatal tetanus. We are trying to see to it that we address leprosy. We are trying to see to it that we go aggressively to fight against tuberculosis. All these public health programs are taken in an aggressive manner. I must thank my development partners who have actively been associated with the Ministry of Health and Family Welfare in routine immunization, or UIP. This immunization program has been successful with their help, working with synergy, and see to it that we give the desired results. We all know that last year we started that Mission Indradhanush program. It was a program well conceived. We had learned from the program of neonatal tetanus elimination. We had learned from the lessons of the pulse polio program. And from those lessons, we tried to address the left out children. We all know that approximately 27 million children are born in this country every year. And it is our duty to see to it that we immunize them. But also it remains a fact that 90 lakh children were left outs. 20 lakh children who were totally unimmunized, and 70 lakh children were partially immunized. This had to be addressed. We took this program of Mission Indradhanush, and I am happy to share with you that approximately 1 crore 42 lakh children were brought into this ambit. They were immunized. The sessions, 20 lakh sessions took place. 37 lakh mothers got the vaccination, and approximately 37 lakh children were totally immunized in this program. We all know that on the year basis, the average increase in immunization was by 1%. But it needs a validation. But our estimation says that now, in 1 year, the vaccination and the immunization has taken place, and the increase is approximately 6 to 7%. That is the increase. And as I've always told, that it is one of the largest World Health Program. And now I share with you that we also introduced the pentavalent. We also saw to it that 4 new types of vaccines are to be included in it. Rotavirus, Japanese encephalitis adult, measles rubella, and IPV. So today is the Rotavirus Day. I am happy and I am thankful to Orissa government. We wanted to launch here in Orissa because to create an awareness also and see to it that the children and this immunization program for children should be taken in the right perspective. This program certainly is going to bring a difference. We have tried to include an approach which we call it as a life cycle approach, where we take care of the mother when she gets pregnant, from that stage of vaccination of the mother, then the child after the delivery for 2 years, then taking the care of the child till adolescent. So it's a life cycle approach which we have developed. And I must say that RMNCHA, the adolescent, has been also added. It has given the due boost which is needed. India Newborn Action Plan is also of great help to us. So we are trying to see to it that we don't only take care of the mother, we don't only take care of the child, but we take a very holistic approach. An approach where in the life cycle we see to it what are the issues which are to be addressed for the mother, for the pregnant mother. What are the issues which are to be addressed for the young child? And what are the issues which has to be addressed when the child becomes an adolescent? So this is one thing which I must say that with your support we should appreciate and make it a meaningful program, and your cooperation will be needed for that. Today, rotavirus has been introduced in Orissa, Andhra Pradesh, Himachal Pradesh, and Haryana. In coming times, it will be launched nationwide, and the same way, Japanese encephalitis adults, the same way, measles, rubella, all these vaccinations will be introduced. This is going to reduce, as I said, it's being a cost-effective program. It is going to reduce hospitalization. It's going to make the child healthier. It will be, we will have a more productive child, very healthy child, and the same way we will be contributing in the public health program. This rotavirus, as has been told by my earlier speakers also, that this happens to be produced indigenously. Ministry of Science and Technology, along with Ministry of Health and Family Welfare, in a PPP model, we have developed this indigenously, and it is really, as we say, they believe in the Make in India program. So this is also one step forward in that direction. Friends, wherever I get an opportunity to speak on such national forums, I'm not able to resist myself from sharing one thing with you. You see, we are doing a very good job. But at the same time, we should see to it that we involve the public representatives. This aspect is missing somewhere. The public representatives are the link between the public and the ministry. They can become a very meaningful instrument. They have got the skills to translate the issues. Their expertise is to translate and to communicate in the best possible manner. But we don't equip them. We should see to it that how do we bring into our fold as far as the health programs are concerned. Ministry of Health and Family Welfare has decided that this year during the Parliament session, after the session is over in the evenings, we will have state-wise meetings with the members' Parliament. We will try to interact with them. We will try to sensitize them about Indradhanush. We will try to sensitize them about the national programs, about tuberculosis, about leprosy, about Kala-Azar, about different issues of health. And we would also like to satisfy their queries, so that with that interaction, when they go to the masses, they are better equipped as far as translating the issues of the health is concerned. I would request the Health Minister of Orissa also to start having an interaction session with the MLAs also, the Zilla Panchayat Pradhans. This is one aspect which is needed. If we do it, they will prove to be a very active instrument in bringing the issues of health in the best possible manner to the public. So this is my request which I would like to bring to your notice. As far as the health programs are concerned, or the governance at the national level is concerned, our Prime Minister, Shri Narendra Modi ji, has given a very clear-cut mandate, and he is very clear that we have to make health assurable. We have to see to it that the health becomes affordable. We have to see to it that we can make people equipped with the health facilities. And keeping that factor in view, as Dharmendra Pradhan ji said, that this year we are going to open generic medicine shops, 3,000 in 1 year. Practically, each district will be having 5 to 6 this Jan Aushadhi chemist outlets. The same way, last year we had introduced the drugs support through NHM at the primary health level center, level, CHC level, and at the district level. Now this year we have rolled out a model where we are going to give them free drugs and free diagnostic till district level. That is what we have tried to share with you. The models have been rolled out. Those models have to be taken, or it has to be accepted by the states. If they go forward, we will be going forward as far as the assurable part is concerned. As our Prime Minister has said about cooperative federalism. Now, cooperative federalism is not only an epitaph, it is not only a slogan, it has to be brought into reality. And keeping that factor in view, we are trying to involve the states as far as possible in the health issues are concerned. Here also, Honorable Minister has mentioned about a few things which are needed for the states, or for Orissa state. I assure him, first of all, as the tertiary care center is concerned, our government is committed to open tertiary care, AIIMS-like institution in every state, and you are one of the lucky ones to get it during the Atal Bihari Vajpayee's regime, and that AIIMS is coming up. I am regularly monitoring and seeing to it that it comes up fast. The same way, approximately 5,325 crores have been spent on NHM here in Orissa. 736 health facilities and 46 MCH are coming up in Orissa. The bed strength is being increased from approximately 2,300 beds are being increased. Renovation of 2,695 institutes and health facilities is going on. You have asked about the 5 medical colleges also which are being upgraded. 80 crores have been sanctioned, and I am told that you have utilized it. I must assure you that funds will not be the problem, and you carry on with the work and we'll go forward in that direction. The same way, we are coming up with 2 super specialty blocks, each to the tune of 150 crores. So that is also going to bring a difference. In the 2 medical colleges, you are having a super specialty block which is coming up. As we believe in cooperative federalism, I must assure the Minister that as far as the health issues are concerned, full cooperation will be there. Whatever support is needed, we are there anxiously. You have done good in health indicators, but under 5 mortality has to be addressed. That is one area. Infant mortality rate also needs little concentration, and I hope you will do the best in that direction also. At the end, as I said, that this is not a routine program. when I was administering the medicine to the children, I was discussing with my colleagues, and Bhanu Pratap ji, the secretary, and C.K. Mishra ji and Rakesh ji were saying that this is a historical moment. Now, from this day, rotavirus vaccine is going to be given to the children to the tune of 2 crores 70 lakh children. So I certainly consider it to be a very historical moment. It is going to go a long way, and it is going to help us to see that India grows healthier and we have healthy children who do their best. That is what I'd like to say. Thank you very much, President.
Thank you very much, sir, for your valuable words and your valuable time. Thanks a lot. Really a heartfelt gratitude.